morning. I'm Dr. Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. Sometimes you need to lose a limb to save a life. Think back to the Civil War. Surgeons would amputate early and amputate often. Obviously, medicine has come a long way, but there are still hundreds of amputations happening every day in America, largely toe and lower leg amputations related to diabetes or cardiovascular disease. But today we're meeting a veteran whose ankle injury simply wasn't healing. Amputation was an option. But doctors at the Veterans Administration Hospital trusted one of our surgeons at the health system to try and salvage that limb. And he did. Well, the team did. We're learning how that happened and what it means for the man who is still living with both of his feet. Later, we're going to check in with Doc Hawk. We'll talk a little bit about COVID, flu shots, and ask about the latest human case of bird flu in Missouri. But first, we're talking with Dr. Charles Christopher Jaley. Now, J-E-H-L-E. Jaley, I said it right that time. That's impressive. We're just going to say Dr. J, a hand, nerve, and microsurgeon here at the health system. And we're happy to be talking with one of his patients, Doug Fiedler. I knew I was going to do that one wrong. Man, I rehearse these names before we each have this program, and I still don't always get them right. Doug Fiedler is still recovering from surgery on his ankle. But the important fact is, both his feet are also here. He's here with his wife, Billy. Thank you so much to both of you for being here. I love your Chiefs shirts, by the way. Let's go Chiefs. I like that. Let's go Royals. Let's go Chiefs. That's awesome. So Doug, you hurt both your ankles 4 months ago. I want to go back up and hear about your time in the Army. So first of all, thank you for your service.
Thank you.
Just a little bit about what you did in the Army.
I went in the Army after high school in '73, and I did retire from the military. We were stationed in Korea and Germany. Halfway through I spent 3 years on drill sergeant status at Fort Leonard Wood, and probably my funnest 3 years. But it fit my personality. But anyway, after that, they offered me to go straight to skip W1, go W2, and I did. And I finished my career as a warrant officer, and had a good career.
That's great. How many years were you in the Army?
20.
That's a long time. And what's a warrant?
I would have stayed in longer if I hadn't got hurt in Desert Storm.
So what happened in Desert Storm?
I got knocked off a tank. And it messed up my back and my legs.
Okay. And was that during the battle or something that happened? Okay.
Yes, it was.
Is that how you earned your Purple Heart?
Yes, it is.
All right. And so that was back in the 80s, if I remember my hit.
91.
Okay, I couldn't quite remember when Desert Storm took place.
It's been a while.
Yeah. So how did you manage day-to-day life with that injury you had?
Well, they put me in leg braces. First, it was just the leg that got hurt the worst, and I had a couple surgeries on it. And but I started favoring it so much I wore out the other one.
Okay.
So now I'm in both leg braces and dodging as many surgeries as I can. Some of them you just can't help.
Yeah.
Thank God for Dr. J. Lee and Dr. Smith at the VA hospital.
So, Billy, from your perspective, how is Doug doing with all those knee injuries?
He's doing good. This last break in his ankles was probably the hardest that we've been through.
Okay.
Because he was so limited, on mobility, and that was hard for him to accept, I guess. And it was hard mentally too, because he's used to getting up and moving around and couldn't for quite a long time.
I've known you all for about 10 minutes, and I don't think you sit still very well, do you?
No.
You couldn't really.
That was the hardest part. They kept me. It was numbed up, so I never really felt the pain.
Yeah.
It was more the sitting and what am I going to do now? And you only can watch so many shows on TV.
That would drive me crazy.
So, and I don't know what I would do with my angel because I couldn't have made it without her through my whole life, pretty much. But
is this your angel right here?
It is my angel.
I get that. Yeah.
We'd get him in a wheelchair and I'd push him all around the VA hospital.
Just to get me out of my room.
Yeah. And
so
get him going.
Fast forward to May of 2024, you broke both ankles. Now I'm thinking you didn't fall off a tank, so how did that happen?
It's a good question. We were down in Alva, Oklahoma, visiting her niece who graduated from college, And we went down there, and I got tired after the graduation, so she took me back to the hotel room, and I lay down and took a nap. But she had forgot her key card, so she called me and said, "I'm on my way. Can you open the door when I knock?" Somehow I got up and didn't have my braces or had socks on, and I opened the door, and somehow or another, between when I opened the door and she came in, I fell.
Okay.
And we don't know why. We don't know if it's when I turned, if the door caught air and knocked me down, but it knocked me down, and I don't remember much after that.
Wow. So what do you think happened?
I don't know if his knee gave out, as he turned, because that's happened before. That's why he always wears his leg braces. Or if he slipped, turning, having socks on. We really don't know what happened. It's a confined space, not very wide. And you could tell right off the bat that his foot was broken because it was hanging off. And it looked horrible, yeah. And so at first they just thought he broke the one ankle. They medevaced him to Wichita to Wesley Hospital, and so they went in and put hardware on both sides of the ankle, had to go in from both sides of his left ankle and firm it up with that. And the next day the occupational therapist came and was going to get him up on the good foot and show him how to kind of maneuver, and he was like, ow, 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 which he doesn't do too much because he has neuropathy in his feet, so he doesn't always feel a lot. And so they came down, the ortho did, and she's like, no, it's not bruised, it's not swelling, it looks okay, and let's just do an x-ray and we'll see. And then they came back and said, we got to do surgery tomorrow. That one's broken. It's got a big old gap, so we got to put hardware on that side too.
So you do get most of your care at the VA. What were your doctors telling you about your ankles?
I don't remember a lot. I got caught part of it that Dr. J. Lee was going to be involved, and they were trying to figure out whether I would be a candidate for the surgery. And we didn't know anything about the surgery. Some people were telling me, you're probably going to lose your foot and half your leg because of it. And, it was a scary time for me. Yeah. I mean, I just couldn't imagine. And then my other angels appeared, Dr. Smith and Dr. J. Lee, and saved my foot.
Does your family think you're an angel?
I don't know. It probably depends a little bit on the day. Yeah, I got to know Mr. Fiedler when he was in the VA. Dr. Smith was his orthopedist, and like you said, Dr. Stites, it's always a team effort.
Yep.
And through our residents who rotate over there and the orthopedists, what had basically happened was an infection kind of was introduced into the system. And in addition to the infection, there was a non-healing open chronic wound that went down into the ankle joint with hardware. And so you start adding these other areas of complication where you have bacteria in a joint where the body
hardware.
can't. Ooh, and then hardware.
That doesn't sound good.
So those are the things that kind of catalyzed my involvement. And like you said, a lot of times the best option, or kind of an option to hasten recovery, is actually amputation, because kind of the traditional feeling is, all right, every day that you're in bed is how many days or weeks of rehabilitation. Anything we can do to hasten that period to rehabilitation. In his case, we had the required orthopedist and our team at KU on the plastic surgery side and the whole microsurgery side to be able to remove that hardware safely, have a good long-term orthopedic plan, and then cover it with good durable soft tissue that could deliver the antibiotics that were needed to the joint.
Wow, so that's a big part of it, is that whole thing about getting antibiotics into the joint required some type of a flap. I think we have some photos from the case. Now, a quick warning for our audience. One photo has some blurred and red flesh in it. So let's kind of walk through this. First, the ankle wound that wouldn't heal, is that right?
Yeah, and this is, akin to an iceberg, where it might seem like a fairly small issue on the surface, and you'd had this for many weeks, and multiple efforts have been made to close this wound up. And the ankle is a unique part of our body where we have a paucity of skin, we have a paucity of soft tissue under it. I mean, if you reach down and touch your ankle now, it's pretty amazing how little tissue there really is
stuff
between
around that.
the outside
like your knuckle
wall
or something.
and you introduce a fracture and hardware to it, then you've got kind of a recipe for complication.
Because the lining covering is just that little bit of skin.
That's right.
Yeah, if anything happens there, that's a problem. Of course, the skin's been open when you put the hardware in. So, well, let's take a look. There's the arm where you plan to take some skin, and I see some purple dots. Is that the marking of the blood vessel? What is that?
Yeah, so this is Mr. Fiedler's arm. That's the radial artery that's been marked out, and when you bring that new tissue down to the leg, you need to make sure it stays alive on its blood supply. Now, we have two large arteries that give blood to our hand, and the majority of people are dominant with the other of the two arteries, so you can borrow it.
Yeah. All right, so, and you can even show us where they borrowed that from. Is that right? If the camera can zoom in on that arm for just a moment, there we go. Now, the next photo is the flap from the arm that was placed on the ankle. Now, was this before or after? Tell us what this is. What's going on?
This
there.
was during the surgery itself. So again, working as a team, our residents were helping both work on the ankle and the arm at the same time, where you have to raise the skin, that fat that we have underneath our skin, and importantly, a kind of shrink wrap covering that sits underneath that called the fascia. And these are all elements to our skin that we can bring back down on the blood vessel that feeds it. And so then on the ankle, we brought out the blood vessels that help feed the leg, and very much like plumbing, under a microscope, plug those into those blood vessels so that blood can go into the flap and come out of the flap and back to the body.
Okay, fast forward a couple of months, and here's how the ankle and the arm have healed. So yeah, let's look at that together up on the camera there. So the skin from the arm went to the ankle, but how did you replace the skin on the arm?
Yeah, so the skin and the soft tissue underneath the skin, so that fat and that fascial layer were all brought up in one large piece with the blood vessel and put on the ankle. And then it's like robbing Peter to pay Paul. You have to make sure Paul can afford it. We left enough on the arm that we were able to bring a skin graft from the leg and replace it. So it's a little bit of, Russian doll situation.
This
where
is
you're
trading
like,
places is what this is.
Yeah.
Yeah.
So
Did you take the skin from the ankle and put it up there where you were putting the other skin, or other different spot?
from a different spot.
Okay.
In his case, it was
All
the
right.
thigh.
And can I just say, is that ankle upright? That's him kind of standing on the leg with that last picture we saw a moment ago?
So in that picture we saw a moment ago, he was sitting down, kind of
Yeah.
sideways there, but
That looks
the
like $1 million compared to the other picture.
It's much better than before, and
Yeah.
I think most importantly, it very much filled me with hope and just made me really happy to watch him walk out at his last appointment he had with me.
Did you walk out of that appointment?
I did. Walked in, walked out.
Man,
So-
okay, right there. That's a big deal. That's Mahomes to Kelsey to win the Super Bowl right there. Actually, it's bigger than that.
Like I said, I am so thankful for Dr. J. Lee and Dr. Smith that
Yeah.
I've got a foot and a leg. I just
And a
would
hand.
never imagine that was me,
Yeah.
And
But
that
boy, they
everything-
just couldn't have filled me with two better doctors.
Yeah.
And everything healed good with his diabetes because we worried about that.
Yeah,
The
diabetes
healing.
makes everything hard,
Yeah.
right? It really
Yeah.
does.
So-
yeah.
But they
Well,
took
that's
good care of him.
amazing. Okay, so Dr. Jelly, where does this operation rank in terms of complexity or difficulty?
Yeah, so it's difficult, right? I mean, everything's relative.
Yeah.
In the scheme of what I do, this is on the more complex side, and trauma or these injuries, infections don't always show up the exact same way. So it takes some level of creativity.
Mm-hmm.
And again, I think that's the harder part is trying to figure out how you bring something from one place and then fit it in within the confines of his anatomy and those things. So for me, this is one of the more difficult surgeries to do. I
Yeah.
don't know, some of our other surgeons who do brain surgery and all those things, maybe it's harder, maybe it's easier, it's hard to know. But
So when you first heard about him, did you think it was all going to work?
well, we're lucky. So limb salvage, as we kind of call this field in general, has about a 90-ish% success rate, which is to say, being able to save.
When I grew up in medicine, it wasn't 90%, so y'all were doing some pretty cool stuff.
Yeah, and I'm happy to say at KU, I actually reviewed our numbers before this just to kind of see where we're at. We're writing some of our experience up over the last several years. We're higher than that by a pretty substantial amount. And
That's
so I'm very,
outstanding.
very pleased that we've got the team and
Yeah.
all the equipment and all the resources necessary here to do
And
it.
all those people, the nurses at the bedside, physical therapists, they all got to be focused on doing this the right way.
Yeah. Yeah, and I mean, even in the operating room, like
Yes.
it requires a very specific set of tools and a microscope, and the people who, prepare the instruments, prepare the microscopes, get everything set up. I mean, it's a huge endeavor, and the fact that it just kind of goes off, choreographed is, I think of it kind of as my version of a patient going on
play.
bypass, right? It's like an everyday
Absolutely.
miracle. How is it,
is an everyday
happening every day? It's
Yeah.
pretty cool.
So Doug, what was the recovery like for you?
It was hard because I had to stay sitting. And I felt bad because Billy did everything in the world for me. And
Okay.
needless to say, she's always been there for me, but this just was really hard that I couldn't do. And I just hated pushing everything off on her. But recovery, it wasn't painful. It was just the thing about not being able to get up
Yeah.
and walk.
Yeah, you don't feel like you're contributing.
That's exactly what it felt like.
Yeah, and I bet you're one of those people who always has to be the one who contributes a lot.
No, she usually is. I'll be honest. With you. I may find something to do, but if it comes to something more serious, she's the one that always does it.
He
All
just
right.
likes to be in charge of everything.
Yeah,
And then he
I
felt
th-
like he didn't have the
I get that right there,
full
sir.
control.
Don't leave me hanging right here. Don't leave me. There you go. That's what I'm talking. Okay, so Billy, how was this for you and watching him go through all this?
It's hard to watch a loved one,
Yeah.
not feeling good, or not being able to do what they had before. And like I said, we had to deal with too this scary part that it could even, end up with not having a foot.
Yep.
And we talked about that we've gotten through a lot worse than that, and we would make it through this, however the outcome turned out to be. But we're very thankful that Dr. J. Lee and Dr. Smith worked together,
Yeah.
the VA hospital and KU Med.
That's awesome. And it should be that way, right? We should be
Right.
working together. So, but I do want to say, you guys are like a little rom-com here. This is very, I love rom-coms. My wife and I sit around and watch those all the time. I understand that you're using a wheelchair to get around. What are your doctors telling you about that? And what's your
Well, we saw Dr. Smith on Monday, and he says it's healing, but it's not all the way healed. So I can walk short distances. I can walk around the house.
Okay.
So, I mean, slowly but surely it's getting better. And
Progress helps.
we got another appointment in 3 months. We'll x-ray it again and see how it's doing.
And
How's the right ankle? Is that the other ankle? How's it?
I've never, don't even pay attention to it.
It's all healed up. It's
Yeah.
doing good. All right. Excellent. Dr. Jaley, in Doug's case and in general, how does saving a limb help somebody's overall health, not just their health of that limb?
Yeah, I think ambulation is a huge part of being able to experience the world. I mean,
Yeah.
despite large
said.
efforts, especially in this country, to make things accessible if you are in a wheelchair or have other disabilities, being able to move around in a more native sense is huge and kind of makes things easier in a lot of ways without so many accommodations.
I like that. So now we're here to answer your questions. Send them using the links on your screen to YouTube, Facebook, or email the Medical News Network. Doc Hawk, that's an amazing story, right? This is it, right?
100%. I mean, that's why you have partners and all of that.
That's
Yeah,
why
for
medicine
sure.
is a team sport.
It is.
Right? It's a team sport. Okay,
It happens in the hospital, but I think the most important thing to realize is that medicine, those things don't stop when you leave the hospital. Your life continues when you're in the hospital, when you're out of the hospital, and we need that support and that team all of our lives.
All right, well, lots to discuss. The summer COVID wave is finally trending downward a little bit. You brought some graphs showing what the wave looked like at the health system. Let's take a look.
Yeah. So the first graph is the positivity rate, and on those you can see the months down at the bottom, and the last month we have on the far right there is August. You can see the red line through there. The red line is our positivity rate, and that rate is really on par with what we saw in the nation for the last couple months, really around that 16 to 18% positivity rate. I think we've commented on that before, and so we're seeing that. So it just goes to show that kind of we were on par with what the rest of the nation was seeing. Obviously, in any community or in any region, you can have a little bit of variance, but for the most part, we struggled with the same issues that the rest of the nation was struggling with, and that was the high circulation rate of the virus and the high positivity rate. And then we also have a graph about our admissions, and you can see there on the far right. Now, the data only goes to August, but you can see that we had a significant amount of admissions admissions in the hospital of people who tested positive with COVID-19 on their lab test. Now, they may have been admitted for other reasons, but had symptoms. But nonetheless, you can see there that before, those few months before that last one, where we had, I think 90 people had those positive tests, but we had a significant lower amount of people in those few months before. But again, this would be on par with the nation and the region, just showing that there was a high level of circulation of the virus and the disease COVID-19 out in the community. And we certainly saw that and did feel that impact here at the health system.
So it's so much better to have it be decreasing. That's a good thing.
Yeah.
COVID shots, have you gotten yours yet?
Yeah. No, I haven't gotten it yet. Right now here at the health system, we don't have it. We are expecting it by October 1st. And I think that it is recommended for everybody to get it. You can see that infographic from the CDC there. Basically, everybody 6 months and over can get the COVID vaccine. What we have said before, Stephen, you know this, and because there was so much circulation of that virus out in the community, if you've had it recently, it is going to be okay to wait about 3 months, 90 days before getting the vaccine, the updated vaccine. And that's just because if you've been infected recently, you're going to have that natural boost to your immune system. After about that 3 months, it will be a good idea to go get it. I will certainly get it. I know my kids had the infection back in the summer, so I'm waiting on that. And then once we get to that point where they can get it 3 months or 90 days later, we'll certainly be giving it to them. We know the benefits of vaccination, and we also know now there is a dominant or a couple dominant circulating variants in the United States, but there's also maybe a new variant on the rise in Europe. So it's going to be very important to get that updated 2024-2025 COVID vaccine. We know that it does help reduce your chance of going to the hospital, your chance of having severe disease, and of course even there's data to support the reduction in the risk of long COVID symptoms as well. So we will be certainly recommending it. I will be getting it once it is available, and then of course my children are going to get it as well.
So I'm thinking right here in the program in October we ought to be. I want to get both. I'm surprised the studio. I hadn't run this idea by anybody, but I'm thinking let's get that shot. No, I'll just get my influenza and COVID on the same day. Let's do it. I can do that. That's awesome.
I think we should. You know, it is okay and recommended certainly to get the COVID vaccine and the influenza vaccine together. And I think that would be a good thing to just show the people that we are getting it and being transparent and able to do it as well.
I think that's awesome. We know that influenza picks up in the late fall, winter months, and so that's still yet to come. It never completely went away this year, though. We were still having some flu cases, influenza stuff, even in the summer, which is a little different.
Yeah, there was a little bit of circulation going around. I mean, certainly the most prominent virus was SARS-CoV-2, but there was that low level of influenza activity as well. Still remains fairly low. I think really the discussion here is when to exactly get the vaccine. The number one thing we want to do is never miss an opportunity to vaccinate. So we have to understand that, but taken with the other side of that coin and the fact that there continues to be, although some circulation, otherwise very low circulation of the virus in the community, we want to make sure that you have enough immunity from the vaccine, again we're talking about influenza, that will last you through the 6 months or so until March or April. And so right now I'm recommending to my patients who have good access to care that we wait until we see either late October, early November, or we see an uptick in the influenza activity. And then if we can wait that long, you will have probably the best immunity provided by the vaccine for that duration of time. And here we have an infographic also showing that there are many products for influenza vaccine. The health department, the health system here, we carry several different products. And different commercial pharmacies or different other clinics may carry something different, but we have several different kinds of products here for influenza vaccine. Remember, this year there are 3 strains in the vaccine as opposed to previous years where there were 4, and that is because one of the strains that was usually in the vaccine we haven't really detected since 2022. So now we only trivalent, so 3 strains in the vaccine. It is recommended for everybody 6 months and older. And again, I think we've had this question before. For those that are 65 and older, the high-dose vaccine is available, and that has actually shown to help reduce the risk of severe disease much better than the regular dosing for the influenza vaccine as well. So we will continue to update you on the overall circulation and community activity of influenza, but right now it remains very low. Certainly if you are at a pharmacy or your doctor's office and you don't anticipate going back anytime soon, it would be reasonable to get the influenza vaccine. But if not, you can certainly wait till later when we start to see an uptick. But I would just encourage you to discuss that with your medical teams.
All right, so there's a Missouri bird flu patient.
Yeah.
What's CDC saying about that? What are you thinking about it?
I think it's interesting. I think there has to be some link. Right now, we have very little information. The public information that is available shows and said that there was a patient who was admitted to a Missouri hospital in late August with symptoms not necessarily of influenza, but relating to an underlying medical disease. At that point, I think they tested the patient because of other symptoms or for one reason or another. They were able to identify that it was influenza A, but then could not identify further, so I think it was sent to the state lab, and that's when they saw that it was actually an H5 influenza. So influenza A, there are many different types. The bird flu is a type of influenza A. It's H5N1 in this particular case. They then realized that it was the typical strain that seems to be circulating in the poultry farms and the dairy cows at this point in time. The patient did receive therapy for it and is recovering. In addition, there were household contacts or contacts that also had symptoms. It seems like the symptoms occurred around the same time, so it's not clear that this patient gave it to those contacts, but maybe they had a common source that they were infected from. But a lot of those details are still not readily available, and I'm not sure they are fully known. But it continues to be very, very low risk for infection with H5N1 for the general population as well, so we don't want to cause any panic, but we will keep you updated as far as any new information from the CDC or the Missouri Department of Health, but otherwise there's not much more information than that.
Just to say, so far what we've learned in the cases that have H5N1 that have occurred in humans is that it's not as bad as COVID, as I understand. I mean, it does seem to be something that we can treat or that you can get through.
Yeah, absolutely. So we do know that it can have a high mortality rate, especially affecting those with chronic underlying medical conditions. And that is a theme that we have talked about for many different infections as well. But what we have seen so far in the United States cases is that those people were not very ill. Their symptoms were not bad at all. They all received antiviral therapy and did very well since that time. Right now, there is no indication that this is going to spark a worldwide pandemic. But of course, we have to be vigilant and continue to monitor the genomes, monitor the patients, and of course, any contacts around those patients. But right now, it's not really clear that there has been any spread from person to person in the manner that you kind of discussed, Dr. Stites. So, yeah.
All right. We know many of you have questions. Let's head to Studio B with Alexis. Alexis, what's going on out there?
We have a great question from Jeremy Yenser. Jeremy wants to know, are there any parts of the body that are better or worse when it comes to taking tissue to repair other parts of the body?
You may, let me just say that back. I think we have a little earphone problem, but one of the questions has been, are there some parts of the body that are harder to do grafting than others, like that doesn't work very well?
Yeah, exactly. That's a great question. Usually the less tissue you have over something, the more difficult it is to actually graft something to that area. So kind of going back and thinking about the lower leg, that last third or around the ankle, there's really not a lot of extra tissue to borrow from one place or another, where on our thighs we have good healthy muscle. We usually have a little extra skin, sometimes a little extra fat, and we can move things around almost like tissue origami.
Tissue origami. That's pretty good right there. I got that.
Super interesting.
Alexis.
Another question from Yen Liang. Now this one is very medical, so we're also going to need you to explain his question, you'll understand. Yen Liang writes, we all know that during surgeries involving the hands or feet, the greatest concern is ischemia reperfusion injury. Can you tell me if there are any new methods to prevent this issue? First, I'd like you to explain what is ischemia reperfusion injury.
Yeah, we'll talk about that. So ischemia reperfusion injury, a great question from Yen Liang, one of our frequent listeners, and that's a spot-on question, though. So talk to us a little bit about what is ischemia reperfusion injury, and are there things that we can do now to help prevent it?
Yeah, so ischemia reperfusion injury is essentially the realization of tissue that hadn't had blood that had been going to it for a while. So you imagine, let's say you go on vacation or something like that, and you turn off your air conditioner, you turn off your electricity, you turn off the water. When you come back to that house later that day, it's fine. If you come back in a week or if you come back in a month, things are going to be substantially worse.
Harder to start it back up.
Yeah, and when you want to get the house going again, you'll notice things that will probably be a problem because of that. It'll stink because the refrigerator's been off. You know, if you haven't had air circulating, there can be mold, things like that. Tissue reperfusion injury is kind of like that. You're now introducing all those things that happened in that tissue that wasn't getting blood and then bringing it to the rest of your body. And so everything has to work overtime to compensate for that. So your kidneys have to work overtime and sometimes get clogged up with some of the toxins and some of the large proteins and things that are released from that damage. And it's kind of like reconciling that period of time where something was damaged. There are things that people are trying. Interestingly enough, in fellowship, we were working on a model with the DoD for actually perfusing limbs, kind of ex vivo, so kind of connecting them up to its own bypass machine and using things that don't contain myoglobin, things that are shelf stable and can be done at room temperatures, with the idea of allowing them to be replanted at a later state. But right now, day in and day out, there isn't anything specifically for either like a finger, an arm, or a hand, because it's so much more important that the core of the body and the core organs like the brain, the heart, the lungs are getting the blood that they need.
Yeah, you bet. And we see that in transplanted organs too, that whole ischemia reperfusion injury thing. Okay.
We have a question from Jill about COVID. Jill wants to know, COVID patients in the beginning had long lengths of stay in the hospital. With this most recent round, what is the length of stay, and do the current variants make them as sick?
So are people getting as sick, and what's the length of stay like, and how are the patients just doing, Hawkeye, with COVID?
Yeah, that's a great question. There's several great questions in there. Certainly, I think we have to say, Steve, and we know this and we've talked about this, those that are at greatest risk, so older age, chronic medical conditions like chronic lung disease, heart disease, immunosuppression if they've had transplants or immunosuppression for other reason, those patients continue to remain at risk and can have long stays and can have ICU stays as well with severe illness. Although what we are finding again, that overall hospitalizations are much decreased from where they used to be. And so I don't think we have any good data on length of stay per se. But we do understand that the total amount of patients coming to the hospital, the total amount of patients with severe disease continues to remain lower. And we know that that is helped, number one, by vaccination, revaccination, previous infection and reinfection, and of course the antiviral drugs we do have to help reduce your chance of coming to the hospital.
Marie has a message for Doug and a question. Marie writes, I want to thank Doug for his service, and so do we. Thank you for your service, Doug. Marie asks, can you ask Doug if he has full sensation in his leg that had the ankle surgery?
How's the sensation doing in that leg?
The leg's fine. It's the feet because of the neuropathy. I don't have a lot of feeling.
And you didn't before surgery, but
No.
the surgery didn't change that
No,
much.
it didn't.
No. But that's more diabetic in nature, you think?
I think it is.
Yeah.
I don't, I'm just amazed at what they did to save my foot, and I hope they do it for a lot of other people rather than just amputate.
Yeah. Yeah. Well, what a difference that makes in your life.
It
right?
does.
Oh
It
my
just-
gosh, the ability to walk. To your point, we are so dependent on walking. You think about the people who have had injuries or have disease that can't prevent them from walking, what a limitation that is in life. Alexis.
This has been a great discussion. I have one more question from Denise, and this is for Doug and Billy. She wants to know if you've had to make any lifestyle changes after this whole string of events.
Lifestyle changes, guys? Except
Yeah.
she had to get better at pushing, it sounds like to me. Push, get some bicep
Ended up
stuff,
being
tricep
amazed
stuff.
most of the time. Can I have water? Or can I get something
Yeah.
to drink? Or, you didn't even have to ask. She would be up going, what do you want? So it changed a lot that way. And even today, it's, you move a little bit slower and but my God, I'm sure glad I got my foot and leg.
So when you get going again in 3 months, when Dr. Smith and Dr. Joel, names, Jaylee, all say, okay, you're good to go. What are you going to go do?
I'm not going to run. I used to love to run, but I'm not going to go jog anywhere.
I think that's a good idea.
Yeah,
Good plan. Well done.
I just would be glad to get back to normal lifestyle.
I think you should go buy flowers for Billy. What do you think? Because that's like a good first thing.
Yeah.
That would be awesome.
There's no doubt that she's been my angel through this.
Yeah,
I've had 3 of them, her, Dr. Jaley, and Dr. Smith.
it's pretty good.
It is. I'm so happy.
Yeah. Sometimes people on earth can be a little bit like that, right? They can be a little bit of an angel. My mom and dad would say, or my wife would say that I maybe not, some days I can be an angel, and other days I can be a devil.
Oh, I'm sure that I fit that category.
All right. This has been a great discussion. I'm grateful for all of our guests for being here. I'm very grateful for the service that you have to
Thank
our
you.
country. That's awesome. So final thoughts from everybody. Dr. Jaley. And I said it right that time.
Yeah, exactly.
I
No.
am educable, apparently.
No, you're awesome. Final thought, it's come up 100 times in this conversation in half an hour, like teamwork, right? Everything is always about teams, and our society is getting more and more insular. Having a support network in home, having a support network outside of your home, even within the hospital, always reaching out for help, asking for second opinions. It's always better than trying to do something by yourself. Always.
It really is, isn't it? It is about the team. Billy, final thoughts.
We're just thankful that Dr. J. Lee does this kind of surgery and that he had enough faith in Doug and Dr. Smith's opinion to go ahead and make him a candidate for it. We really are appreciative.
Yeah. Sir.
And I've told you, there have been 3 people in my life that saved this, and gosh, I hope they can help other people. That's been a biggie for me.
Yeah.
And that's one of the reasons we decided to do it. If it's not us showing what happened to me, but showing there's help for people and hope other people would start doing it rather than amputate.
Okay, my final question to both of you. First of all, favorite player on the Chiefs?
Oh, I like Kelsey.
Ah, Kelsey.
But I like his
And
brother
Taylor.
more.
Oh, yeah, he's pretty good.
I like Jason.
Jason's favorite player on the Chiefs?
Mahomes, probably.
Mahomes. I know. Okay, here's that. Favorite person you ever had in the U.S. Army? Because that hat means everything. So, favorite person in the Army?
Probably
Who's your
General
hero?
Rutherford. General Rutherford.
Yeah, General Rutherford was a big example for me.
Okay.
And always come and checked on me when I was a maintenance tech for a battalion. He'd always just make sure I had what I needed.
Oh, that's awesome. It takes a team.
It is.
In the
It
Army,
did.
in healthcare, in football. Hawk, final thoughts.
Yeah, I think we're going to have to continue to endorse vaccines. There are now the new updated COVID vaccines available. Obviously, there are the influenza vaccines available too. And I would just like to kind of point out, CDC does have an app. If anybody is willing to go do that, just download an app, and you can actually figure out kind of what vaccines you need or talk with your medical teams about what vaccines are important to have to be up to date with the vaccines to protect you and reduce your chance of getting the infections and, more importantly, the disease and the severe effects of those disease, both for you and your children, because we know around the country, around the world, there has been a significant decrease in the amount of vaccine uptake, and that has led to more and more outbreaks or local community outbreaks of diseases that we had normally had under control. So it's very important to protect you, your family, and your community. Please stay up to date with your vaccines.
And I always like to talk about the intersection of hope, faith, and science, and I think we've heard a little bit about that story today. I think sometimes we don't talk quite enough about the impact of teamwork, and I think you guys have just done a great job talking about that. In a health system every day, there's amazing examples of people who are sacrificing themselves and their days and and their work hours, etc., to try and help others. And hats off to our teams here at the health system, the people like Dr. Jaley and Dr. Smith, the nursing team, the OR team, physical therapy team, occupational therapy team, all the folks who help keep us put together.
Yeah, and the residents, the trainees.
The residents,
in a place
absolutely.
Like
the students, everybody.
KU, we're trying to teach people to do the same thing and pass it forward, and they work incredible hours.
And it always takes a team to help save a life. Thanks again to all of our guests and to all of our audience. Remember, hope, faith, and science. Together, we can do just about anything. We'll see you soon.
Instead of driving hours to find the right doctor, Glenn Verdon only had to drive 15 minutes. I'm Alexis Delsit on the next All Things Heart. In a town of less than 3,000, we share the work being done to bring the best access to rural communities.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.